This year, India has hosted the presidency of the G20 meeting. It has been a long, nearly 12 months journey on various sectors, including the health stream or technical working group, which UNICEF has been a member and participating member of. I believe that during the presidency, India has put forward three very important areas that touch on issues for all of us, on global health issues. One is taking cue of what we have all been going through, which has been the COVID-19 pandemic. So the first area is to continue investing in pandemic preparedness. This means proposing that all countries coordinate and invest in such a way that we are collectively, as health sector, as countries, as individual citizens, well prepared should another pandemic hit the world. And I think that global experts don't use the word should, but mainly focus on what will happen and when. It's not given really as an hypothesis, more as something that will come. The second big priority that India has proposed through its G20 presidency, equally important, has to do with the equitable access for everybody in the world to vaccines, diagnostics, and therapeutic treatments if there is again any global health event. So this means again taking cue from the lessons of COVID-19 and what happened in terms of accessing different vaccines at different prices, at different speeds across the globe, trying to promote the setup of mechanisms across the globe that allow regions and countries to produce and have availability of affordable countermeasures. This is the new term being used to talk or to describe the vaccines, diagnostics and medicines at any point in time. And again, really the underlying principle is equity. And there is a view of creating hubs and spokes when it comes to manufacturing and much stronger coordination of the pharmaceutical sector to manufacture at a speed, quality, and also with an approach that doesn't discriminate anyone. Third and last stream that India has proposed as a new initiative is a strong coordination to promote further and integrate across countries digital health as a means to enhance knowledge of citizens, access to care, and again to improve equity, because of course digital health, if well coordinated, can cut a lot of costs and provide a lot of specialist care also in areas that otherwise would be geographically discriminated, or for people who would financially not be able to afford it. So each of these three streams, I believe, have certainly a potential impact on global health, and India has a lot to say in these three priorities. So not only India has put it forward as an agenda, but it's also something on which the country will be in a fantastic position to contribute to whatever the 20 countries will decide to take up going forward next year when Brazil will hold the next presidency. UNICEF is a partner of the Ministry of Health and Family Welfare, and we work very closely with the Union Ministry and also with health missions across states since nearly 75 years now. The priorities from UNICEF side do not change, have not changed, and stay the same. At the end of the day, we are here in this country to promote rights of every child, and in particular case of health, really the right to life, the right to survival, and the right to good health. So for us, the key agenda stays the same over time and across geographies. What will happen now, or what we see happening, is therefore not a change in our overarching priority, but more a close observation of what is changing in India, in a country that is really transforming very fast, and therefore a need for us to adjust the support we can give to the government of India, to the civil society, to the population, in terms of what is needed going forward. And what we see is essentially a country that in its fast transformation is moving across two lines, or two big directions of travels. One is the past, if you will. Children in this country are sadly still dying of preventable causes, and so are women during and after pregnancy, and these needs to be addressed, and the progress done so far needs to be taken to a final stage of eliminating every death that is preventable. So this is one agenda that takes us into finishing business, if you will, and pass me the term, in terms of child mortality. There's a second aspect that I want to bring to attention, and this has to do with the fact that the country is really moving fast, transitioning to a new economy, and we start seeing new trends or new features in terms of epidemiology that were not here before. Overnutrition, mental health, developmental issues or for children are all effects of pollution or other climate related issues are all new problems or areas in which we need to work beyond the agenda of mortality to start making sure that not only the children survive, but also that they can grow healthy, they can be screened on time, identified, referred to services that can help them address these more congenital issues or long-term side issues, and move them through life. So what I'm saying is that in essence, non-communicable diseases will take a larger share of child development issues here in India, and therefore as one agenda is finishing, the other book needs to be opened, and that is really where government is on the lead, of course, and we are here on both fronts to bring partnerships, to bring international experience, to bring funding where required, technical assistance, so to help as and if required the Ministry of Health and Family Welfare to address both agendas faster for all children of the country. Digital health is an amazing opportunity in these days for all of us in the world. When I reached India 4 years ago, after landing and understanding more or less where I was, I concluded, and it's a frequent joke I make, that there is more apps being produced on a monthly basis in this country than population of the country itself. This is to say digital health is really booming everywhere, and India is really a lead country in this. But I want first of all to remind all of us that digital health is just a means to an end, is not the end in itself, and therefore it needs to be used with clarity on why this is being introduced and for what, in terms of supporting the population. With this premise in mind, there are some really important areas, and we have learned a lot during COVID-19, that speak to the effectiveness, efficiency, equity of digital health. One, let's think of information to population. People can learn through secure, safe channels of information, and really learning can be a mix of videos, audios, text, and anything else that can enhance and improve people's understanding of preventive behaviors. Second, people can be quickly linked to health services. I can receive reminders, SMSs, addresses, contact numbers that can help me get in touch with services as and if I need it. Or I can ask questions, there are bots and the likes that can help me, or videos, navigate through any problem or doubt that I may have. A third, if I live in an area that is far away or if I need a very specialist service, I can benefit of telemedicine. I can simply get connected to a healthcare provider who is sitting somewhere else in the country and get a good specialistic advice from someone without moving from home. So these are just 3 examples, and we could make many more to say digital health cuts steps towards knowledge, access, availability of care for children, for women, for adolescents, and for the population at large. So it's an amazing tool that we have at disposal. We need to use it wisely, not to disperse energy or fragment it. And the last piece I want to bring forward is also that digital health will be of immense help in planning for health services. And planning for health services means sound allocation of the funds, efficiency and better investment of, in the end, taxpayers' money that the government then reinvests in the health sector. So it's a potentially a groundbreaking new weapon that we have with us, and going forward, India can really play a major role globally in promoting digital health across countries. So first of all, when 20 countries get together and discuss of global health issues, just by the fact that the share of the population, it varies across countries, but is significantly made of people under 18, by default, a good set of the actions decided involve children in itself. So because they are part of the whole. I think in particular, if I look at this G20, first of all, I want to commend the effort made by the government of India in convening an ad hoc event that focused on adolescents, because it allowed the adolescent children to bring their voices to the G20 agenda. And I think that this has been a very commendable effort in terms of how, although it's a one-day event, but still participation from children can be put on the scene and made be part of this long and intense journey of G20 deliberation. Besides and beyond that, the key priorities put forward from India have 2 major underlying, or one, if you will, approach or principle, that is ensuring access to universal health coverage and therefore a strong lens of equity across countries, across the country, across gender and other dimensions of poverty and discrimination. And by default, if we talk of equity, we are really doing a big favor and service to children, because they are the ones that statistically, by default, suffer the most if there is inequities in terms of impact on their health outcomes, being weaker and more exposed because of simple biological reasons. The big priorities of India can also really benefit women and children in particular. If we look at pandemic preparedness and we think of the impact that the pandemic has had on children and adolescents, and let's not even consider the health impact that maybe has been not that big, but let's consider the social effects that the pandemic has had on the development, the mental health, the education, the well-being of millions of children and adolescents across the world. Now, investing in preparedness means essentially protecting our future generation from another shock, whereby for 2 years they are locked in a house and unable to develop those social skills that allow them to grow into life. Another area that speaks to the same concept is equitable access to medicines, to vaccines, and to diagnostics. Again, we know that in many developing countries, the big discrimination touches on children first and the most, especially as they grow into the early stages of life. So creating a system that speaks to addressing issues when it comes to providing medicines to the population by default will hopefully make, let me use an example, vaccines more widely and easily accessible to every child across the globe. And we know that there is still a long journey to go in many countries to achieve the minimum immunization rates for children that really can help all of them to prevent disease. So also this element of accessing treatment should a child get a diarrhea or a pneumonia is cheap, but it's not always available. So this other element will hopefully, together with a strong health workforce, make care more accessible for children. So I think the focus of the G20 has been taking stock of the learnings of the pandemic and looking at 3 big actions that can help better address the pandemic. But there's no doubt that whatever will be done on those 3 streams will indirectly, actually directly and immediately benefit children for better access, more equitable access, more affordable to the basic preventive and curative services they need.